no government program needs increased transparency and accountability and honesty more than the Affordable Care Act, known as Obamacare. It has proven time and time again to, in fact, have made false claims. Every member on both sides of the dais can agree that the Affordable Care Act, or Obamacare, is a large, expensive program reliant on a complex network of government programs which significantly impact the lives of all Americans. And yet the history of design passage and implementation with the law is fraught with half-truths and deceptions. If you like your doctor, you will be able to keep your doctor, period. Nothing in Obamacare forces people out of their health plans. No change is required unless insurance companies change existing plans. Healthcare inflation has gone down every year since the law, Affordable Care Act, has been passed, and that it now has the lowest increases in health care cost in 50 years. To that we add, we've got close to 7 million Americans who have access to health care for the first time because of Medicaid expansion. If you like your plan, you can keep your plan. When trying to pass Affordable Care, Obamacare, the administration repeatedly claimed that the law's individual mandate was not a tax. However, months after passage, in a brief defending the mandate's constitutionality, the Justice Department argued just the opposite, that it was a tax.
If CBO scored the mandate's taxes, the bill dies. Okay, so it's written to do that. In terms of risk-rated subsidies, if you had a law which said healthy people are going to pay in, it made explicit that healthy people pay in and sick people get money, it would not have passed. Okay, just like the lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to getting the thing to pass.
Professor Jonathan Gruber is considered by many as the architect of Obamacare. As a former Obama administration official put it, Professor Gruber was the man on Obamacare, the guru of health care. The official we went on to say, I remember that when I was at the White House, he was certainly viewed as an important figure in helping to put Obamacare together. No one can look at the amount of money he was compensated for his work on Obamacare, totaling millions of dollars, and think that our witness was anything but a critical player in the Affordable Care Act. This is a perfect pairing, a pairing of individuals who are in fact responsible for what we know and don't know before, during, and after the passage and implementation of the Affordable Care Act.
As far as I can tell, we are here today to beat up on Jonathan Gruber for stupid, I mean absolutely stupid, comments he made over the past few years, and then drill and grill Administrator Taverner about what appears to be an inadvertent mistake in reporting ACA enrollment numbers. Let me be clear, I'm extremely frustrated with Dr. Gruber's statements. They were irresponsible, incredibly disrespectful, and did not reflect reality, and they were indeed insulting.
Dr. Gruber, it's now your turn. Thank you.
Chairman Issa, Ranking Member Cummings, and distinguished members of the committee, thank you for the opportunity to testify voluntarily today. I'm pleased to be able to address some statements I've made regarding the Affordable Care Act and the reaction to and interpretations of those statements. I'm a professor of economics at MIT. I'm not a politician nor a political advisor. Over the past decade, I've used an economic microstimulation model to help a number of states and the federal government assess the impact of healthcare reform on healthcare systems, government budgets, and overall economies. I've had the privilege of working for both Democratic and Republican administrations on healthcare reform efforts. I worked extensively with Governor Romney's administration and the Massachusetts legislature to model the impact of Governor Romney's landmark health reform legislation. I later served as a technical consultant to the U.S. Department of Health and Human Services and provided similar support to both the administration and to Congress through economic microsimulation modeling of the Affordable Care Act. I did not draft Governor Romney's health plan, and I was not the architect of President Obama's health care plan. After the passage of the ACA, I made a series of speeches endeavoring to explain the law's implications for the U.S. healthcare system from the perspective of a trained economist. Over the past few weeks, a number of videos have emerged from these appearances. In excerpts of these videos, I'm shown making a series of glib, thoughtless, and sometimes downright insulting comments. I apologize for the first of these videos earlier, but the ongoing attention paid to these videos has made me realize that a fuller accounting is necessary. I'd like to begin by apologizing sincerely for the offending comments that I've made. In some cases, I made uninformed and glib comments about the political process behind healthcare reform. I'm not an expert on politics, and my tone implied I was, which is wrong. In other cases, I simply made mean and insulting comments which are uncalled for in any context. I sincerely apologize for conjecturing with the tone of expertise and for doing so in such a disparaging fashion. It's never appropriate to make oneself seem more important or smarter by demeaning others. I knew better, I know better, I'm embarrassed, and I'm sorry. In addition to apologizing for my unacceptable remarks, I'd like to clarify some misconceptions about the content and context of my comments. Let me be very clear. I do not think that the Affordable Care Act was passed in a non-transparent fashion. The issues I raised in my comments, such as redistribution of risk through insurance market reform and the structure of the Cadillac tax, were roundly debated before the law was passed. Reasonable people can disagree about the merits of these policies, but it is completely clear that these issues were debated thoroughly during the drafting and passage of the ACA. I would also like to clarify some misperceptions about my January 2012 remarks concerning the availability of tax credits in states that did not set up their own health insurance exchanges. The portion of these remarks that has received so much attention lately omits a critical component of the context in which I was speaking. The point I believe I was making was about the possibility that the federal government, for whatever reason, might not create a federal exchange. If that were to occur, and only in that context, then the only way that states could guarantee that their citizens would receive tax credits would be to set up their own exchange. I have a long-standing and well-documented belief that health reform legislation in general, and the ACA in particular, must include mechanisms for residents in all states to obtain tax credits. Indeed, my microsimulation model for the ACA expressly modeled for the citizens of all states to be eligible for tax credits, whether served directly by a state exchange or by a federal exchange. I'm not an elected official, nor am I a political advisor. I'm an economist who ran a complex microsimulation model to help Republican and Democratic politicians and their advisors understand the impact that their policies would have on healthcare systems. The recent response to my comments at academic and other conferences exceeds both their relevance and my role in healthcare reform. I behave badly, and I'll have to live with that. But my own inexcusable arrogance is not a flaw in the Affordable Care Act. The ACA is a milestone accomplishment for our nation that has already provided millions of Americans with health insurance. Our country is embarking on an exciting second open enrollment period that will provide new opportunities for these individuals and millions more to choose the insurance plan that works best for them. While I will continue to reflect on the causes of my own insensitivity, I hope that our country can move past the distraction of my misguided comments and focus on the enormous opportunities this law provides. Thank you.
I was at the Kennedy Center Honors, where they honored Tom Hanks, famously Forrest Gump, the ultimate in successful stupid man. Are you stupid?
I don't think so, no.
Does MIT employ stupid people?
Not to my knowledge.
Okay, so you're a smart man who said some, as the ranking member said, some really stupid, and you said the same. Is that correct?
The comments I made were really inexcusable.
These statements, we'll enter them for the record, and I can't imagine how you don't recall your own statements, because the American voter has seen them over and over again as you've called them stupid. Do you deny making these statements, Mr. Gruber, even though you don't recall them? Do you deny calling Obamacare a tax?
If you're reading my actual quotes, then I don't deny it. I
am reading your actual quotes.
Then I don't deny it.
Okay, so you're not here to recant it or to deny it.
I'm here to explain that a number of those comments were made in a tone of expertise that I don't have when I was talking about
Mr. Gruber, do you know what a tax is? I mean, you do have, expertise in economics. Do you know what a tax is?
Yes.
Okay. So you would not deny today that in these statements that you made that Obamacare is a tax, would you?
Obamacare is a large piece of legislation with many parts,
And is one of those parts a tax, Mr. Gruber?
there are some taxes in Obamacare,
Well, the
yes.
president, as you know, argued that Obamacare was not a tax until it went before the U.S. Supreme Court as to whether or not Obamacare was a tax, and then the administration argued that it is a tax in order to be able to save it from being declared unconstitutional. So I would assume that you agree with the U.S. Supreme Court that Obamacare provisions include taxes, right?
The U.S. Supreme Court ruled on a particular provision of Obamacare about
You do not disagree with them, do you?
I'm sorry?
You don't disagree with them that there are elements of Obamacare that constitute tax?
I don't agree with their conclusion about the mandate.
Could I request then that the witness provide the committee with the amount of money received from the federal government and any other health care payment that he received since the beginning?
And I apologize that this is a technical rule of the committee, folks. Yeah.
It's a simple request. Can he provide us that?
And once again, the committee is welcome to work with my counsel on that.
Mr. Chairman,
Mr. Jordan.
why didn't he just tell us? How much money did you get from the state taxpayers and the federal taxpayers? He's under oath. Why didn't he tell us how much he got paid by the taxpayers?
Does he have the time?
We don't have to wait for him to send something to us. He should just be able to tell us, how much did the taxpayers pay him?
Can we have a witness under oath?
Okay, I'm gonna go on to other questioning, and we will see what we can get as a further determination. But it is at this point I'm being advised that this is not an accurate and full disclosure. So we do disagree with your counsel's interpretation. By your own testimony, we find your submission deficient, and your counsel is ill-advised to say that it is sufficient, because it only includes grants, and you have contracts, and you've admitted under oath that you have contracts. So those are not listed, and you are deficient.
I was informed that I should report all federal monies received through grants or contracts for this fiscal year and the previous 2 fiscal years. I did that. I've received no federal contracts.
I don't care what you were informed, Mr. Gruber. I care about what I'm asking you. And what I'm asking you is, how much money did the taxpayers, state or federal, pay you to have you then lie to them? That's what I want to know.
Over this fiscal year and the previous 2 fiscal years?
No, total. I mean, look, this is, this has been a 5-year ordeal with this law. We want to know how much you got from the taxpayer and then made fun of him after you got the money and lied to him.
I don't recall the total.
So now what I'm seeing is that employers are running away from their health care obligations, because now they're going to be taxed a 40% tax on everything over and above the limits that have been established under the ACA.
President Obama took office, did you go to the White House?
I don't recall exactly.
Was it more than 20?
No, it was not.
I believe it was more than 20. How many times do you think it was? Going to the White House is a significant event. You probably remember it. So
I made a number of visits to the White House, primarily to the Executive Office building, to meet with members of President Obama's staff.
did you ever meet with the president?
I met with President Obama once during discussion.
How long was that meeting?
It was a meeting that lasted maybe an hour and a half, of which, with about 20 people, I spoke for about 5 minutes.
Federal government related to the Affordable Care Act, healthcare.gov, or any other healthcare reform proposals?
Once again, if that's a request of the committee, they can take that up with my counsel. I'm sure that.
No. We're asking you, not your counsel. Counsel works for you. So we're asking you under oath, will you provide this information to this committee?
Once again, if the committee can take it with my counsel, if it's a.
No. Mr. Gruber, we're asking you, you've been paid by the American taxpayers. Will you or will you not provide that information to this committee?
Once again, the committee can take it up with my counsel.
Mr. Chairman, this is something we have got to get to the bottom of. I think members on both sides of this aisle should demand that those documents paid for by the American taxpayers be part of the public record. What are you hiding? Why won't you give those to us? Why are we not in